There's a lot of things that are wrong with the current prehabilitation space across the US. It's fragmented, it can be time limited, and there's also a limitation on the workforce as well. So patients aren't getting the specialised and personalised care that they deserve and need to have the best surgery outcomes. Rehabilitation and perioperative care is so important throughout the US and the world for a variety of reasons. The first one being that a lot of patients aren't aware of the influence they can have on their own surgical journey and the outcomes. So by making these holistic lifestyle changes, they can have much greater surgery outcomes, they can have reduced risk of complications, reduced length of stay. And also the hospital themselves can benefit massively in regards to patients being in for their operation and back home where they want to be much sooner. Surgery Hero is an evidence-based solution. So we have a variety of evidence based around randomized controlled trials, quasi-studies, and also real-world case study evidence, which includes reductions of length of stay of 2.6 days, reductions in post-operative complication rates of 65%, increases across all levels of patient health activation, or PAM scores, and also significant return on investment savings. The first way being that a lot of the care provided at the moment is extremely time limited. Clinicians and hospitals don't have the time or the access to provide personalised, detailed and surgery-specific care, whereas we do. Also, we can follow up with patients on a weekly basis to make sure that the information they've been given from their clinicians is being acted upon to maximise themselves. There was a few challenges when we were developing Surgery Hero. One of the first ones being that a lot of healthcare providers and hospitals can want the evidence, whereas initially when you're starting with a new company, you don't have that evidence to start with. We tackled that by getting some case studies live across the UK originally and now across the US as well, to make sure that we could prove that the work we put in as Surgery Hero was having tangible benefits for both patients and healthcare systems. Key learnings from Surgery Hero's journey that shaped our product development would have been linking in very closely with patients and clinicians throughout the journey, just to make sure that the solution we're providing was, one, needed, so didn't already exist, two, was affordable, and three, was also sustainable in this world's climate in regards to equality, diversity, inclusion, and also sustainability in regards to CO2 emissions and COVID precautions as well. So we have a specialised in-house R&D team who are continuously developing the tech to make sure that we can scale up our service and support more patients. We have nudges involved in AI that will be developed to be involved to make sure that, as well as supporting patients one-on-one with our human health coaches, we can also support them out of hours to answer their questions when they're most in need. Surgery Hero has had significant impact on patients, and we have a lot of case study information that we can share from patients, which is on our website under the case study section. I can also share some specific information in regards to the outcomes that I have touched on. So we have been able to reduce length of stay for patients in hospital by 2.6 days on average. We're reducing the risk of post-operative complications for patients by 65%. We're increasing the self-empowerment of patients so that they can take control of their own healthcare and that surgical journey. And we're also making sure they have access to that knowledge to continue to build upon those holistic health foundations throughout the rest of their life as well. We collaborate with a variety of perioperative experts in the field to make sure that the information we're putting out across the app is accurate and the most up to date. We have a chief medical officer who specialises solely within this role, and we also work with perioperative care leaders throughout the world to make sure that we're referencing their evidence. We work with patient health boards as well to make sure that we have patients at the heart of what we do. We have them influencing the decisions that we make and build into the app to make sure that it's sustainable and it's suitable for everybody. I envision the future of perioperative care as a system where everybody gets a personalised approach to prehabilitation and postoperative support. So a system where Surgery Hero is at the heart of it. We can provide one-on-one human health coaches. We can tailor the information patients see so that they're not being bombarded with a lot of information that isn't quite relevant for them. We can support patients throughout the whole lifestyle journey of that surgical procedure to make sure that from the day surgery is even considered to the day of their final recovery, that they have felt that they've been supported, they've had a personal approach, and that they can truly trust the health coach at Surgery Hero. One of those is that we're based now within North America to make sure that we can support our customers in this region more efficiently. We also have an in-house team that works to develop the app continuously based on feedback from customers and from patients as well, just to make sure that we're consistently able to scale up what we do. We have our human health coaches at the heart of everything, who are currently supporting around 100 patients each. Our aims are to scale that up continuously so that we're at a position where we can support thousands of patients and we can continue to keep that high level of quality care as well. For health tech innovators seeking meaningful healthcare solutions, I would give the advice that it's imperative that you work with patients and healthcare providers to make sure that your solution is meaningful first and foremost and is actually needed. So make sure that you're not just building a solution for a problem that doesn't necessarily exist to the extent that you think it exists or isn't necessarily needed. Making sure that you're working with equality, diversity, inclusion groups, sustainability groups to make sure that your product is going to be relevant for the modern age and is also going to be something that can be continued throughout the years.